What if I told you that the very first thing you do every morning, before you've even brushed your teeth, might be doing more to age your kidneys than anything you eat all day? Not a symptom, not a diagnosis, a habit, something so automatic, so built into your morning, that you've probably never once thought to question it. I'm Dr. Richard James, and for years my focus has been preventive health for adults over 55, specifically the small everyday choices that quietly protect an organ, or quietly wear it down, long before any symptom ever shows up. Your kidneys don't complain. They don't ache like a knee or announce themselves like a headache. They just keep filtering, day after day, until one day a blood test comes back and the damage is already sitting there in the numbers. Today I want to walk you through 7 ordinary morning habits that research now links to faster kidney aging. Not extreme habits, not rare ones. Habits that a huge number of people watching this video are doing right now this morning, without a second thought. I want you to stay with me through all 7, because the very last one, the one I've placed at number 1, is something almost every single person watching this does before their feet have even fully hit the floor. It is one of the most common morning rituals in this entire country, and I would bet good money your doctor has never once brought it up at an appointment. When I explain what it's actually doing inside your bloodstream, I think it's going to change how you think about your morning entirely. Before we get into it, I want to hear from you. Drop your age in the comments and tell me the very first thing you do most mornings after your alarm goes off. Do you reach for water? Coffee? Do you sit down before you move at all? I read every comment, and honestly, your answers shape what I cover in future videos. So take a second, write it down, and let's get into this together. Alright, let's talk about what's actually happening inside your kidneys while you sleep, and why the first hour after you wake up matters so much more than most people realize. Here's a fact that surprises most people the first time they hear it. Right now, your kidneys are filtering something close to 50 gallons of blood every single day. Not 50 gallons of urine, 50 gallons of blood, pass through roughly 1 million microscopic filtering units in each kidney, called nephrons, over and over, around the clock, without a single day off. The problem is that this filtering system was not built to last forever at full capacity. Starting somewhere in your 30s or 40s, you begin losing a small percentage of those filtering units every year, a process doctors call glomerulosclerosis, which is really just scarring of the tiny filters themselves. Under the age of 40, less than 5% of those filters typically show this kind of scarring. By the time most people reach their 70s or 80s, that number can climb toward 30%. Along with that, your overall filtration rate, what doctors call GFR, tends to decline by roughly 3/4 of a point to a full point every year after your 30s, and that decline speeds up noticeably once you're past 70. Now, here's why this matters for a video about mornings specifically. A younger kidney has what I like to call deep reserve. It can absorb a rough morning, a skipped glass of water, a strong coffee, a salty breakfast, and barely notice. An older kidney has far less of that cushion. It's already running with fewer filters and less blood flow. So the same habit that a 35-year-old shrugs off can genuinely strain a kidney at 65 or 75. And mornings, specifically, are when your body goes through its biggest hormonal and physical swings of the entire day. Blood pressure rises sharply. Cortisol, your main stress and alertness hormone, surges. Fluid levels are at their lowest point after a night without drinking anything. I call this window, roughly the first 2 hours after you wake up, the morning vulnerability window, because it's the single period each day when an aging kidney is asked to absorb the most change with the least reserve to do it. Here's the part that should genuinely concern you. Somewhere between 35 and 37 million adults in this country are currently living with chronic kidney disease, and up to 9 out of every 10 of them have no idea it's happening. No pain, no warning, the whole condition can progress silently for years before a single symptom appears, which is exactly why the habits that quietly accelerate it deserve far more attention than they get. If any of that surprised you, if you had no idea that 9 out of 10 people with kidney damage are walking around completely unaware, type aware in the comments right now. I want to know this landed. Now let's get into the 7 habits themselves, starting with the one that seems the most harmless and building toward the one I promise you did not see coming. Habit number 7. The chair that steals your circulation. Picture a fairly common morning. You wake up, you make your way to the kitchen table or your favorite chair, and You sit there for the better part of an hour. Coffee, the news, maybe breakfast eventually. Nothing about that sounds dangerous. It sounds like rest. Here's what's actually happening while you sit still. Your blood vessels have a built-in mechanism that keeps them flexible and open, but that mechanism only switches on when blood is actually moving with some force through the vessel. Think of it like a toll plaza that only opens its lanes once it detects real traffic. Movement is the traffic. When you're still, the lanes stay closed, and the vessel lining doesn't produce as much of a molecule called nitric oxide, the substance that keeps blood vessels relaxed and open. Less nitric oxide means stiffer vessels, and stiffer vessels mean more resistance for your kidneys to push blood through. At the same time, sitting still delays how quickly your muscles activate the transporters that pull sugar out of your bloodstream after you eat. So the same breakfast that would have been cleared efficiently after a short walk instead lingers longer in your blood, and that prolonged sugar exposure has been tied to higher levels of inflammatory markers that correlate directly with declining kidney filtration over time. Ask yourself honestly, does your morning routine involve sitting for the first hour or more before you move your body at all? If the answer is yes, you're not doing anything wrong on purpose. You're just missing a signal your kidneys are quietly asking for. The fix here costs nothing and takes almost no time. 10 to 15 minutes of light movement before you settle in for the day. A short walk, some gentle stretching, even puttering around while the coffee brews, is enough to switch that system back on. Habit number 6. The first cigarette before the first meal. If you smoke, and I know not everyone watching this does, the timing of that first cigarette matters more than you'd think. Lighting up before you've eaten or had any water means nicotine hits your bloodstream fast and hard, with nothing to buffer it. Nicotine attaches to receptors on your adrenal glands and nerve endings, and within moments it triggers a surge of stress hormones, the same ones responsible for a fight or flight response. That surge causes blood vessels throughout your body to clamp down, and inside your kidneys specifically, both the vessels bringing blood in and the ones carrying it out constrict sharply. It's a bit like squeezing a garden hose midstream. The water doesn't stop, but the pressure and flow drop hard, and they drop within seconds. Beyond that immediate squeeze, cigarette smoke carries reactive compounds that damage a protective, mesh-like lining inside your kidney's smallest blood vessels called the endothelial glycocalyx. Once that lining is degraded, protein that should stay locked inside your bloodstream starts leaking into your urine, which is one of the earliest measurable signs of kidney strain. I'm not here to lecture anyone about quitting smoking in a video about morning habits, but if you do smoke, simply delaying that first cigarette until after you've had water and something to eat gives your body a chance to buffer the impact, and it's a far gentler place to start than trying to quit cold on your hardest morning habit. Number 5. The loaded breakfast plate. This is the one most people never suspect because it looks like a completely normal American breakfast. Bacon or sausage, a cheese-heavy omelet, white toast, a glass of sweetened juice, maybe a bowl of frosted cereal. It looks like food. What it actually is, from your kidney's perspective, is two separate assaults happening within the same 15 minutes. The first is sodium. A salty breakfast pulls extra water into your bloodstream almost the way a dry sponge pulls water out of a puddle, expanding your blood volume. To push that extra sodium back out, your kidneys respond by raising the pressure inside their tiniest filtering capillaries, a process researchers call hyperfiltration. It sounds efficient, but it isn't free. Studies tracking sodium intake in people with high blood pressure found that a meaningful increase in daily sodium can raise glomerular filtration pressure by more than 14 points, and that repeated pressure spike is exactly what stretches and damages the delicate filtering membrane over years. The second assault is sugar. When your blood sugar spikes after a syrupy, refined carbohydrate breakfast, sugar molecules begin sticking to proteins in your blood vessel walls, almost the way caramel clings stubbornly to the bottom of a pan you forgot to stir. Once that sticky layer forms, called an advanced glycation end product, it triggers inflammation right where your kidney's smallest vessels live. This isn't a small population problem either. Among American adults with diagnosed or undiagnosed diabetes, close to 4 in 10 already have chronic kidney disease. Even among people with prediabetes, roughly 1 in 9 already show signs of it. If you grew up on bacon and eggs or a bowl of sweetened cereal every single morning of your life, type breakfast in the comments. You are absolutely not alone. And I promise this isn't about giving that up forever. It's about which version of breakfast becomes your default, what to do instead. Keep breakfast sodium under about 500 milligrams when you can, and lean toward complex carbohydrates, fiber, and lean protein, eggs, oats, berries, a handful of nuts, rather than the cured meat and pastry combination. Your kidneys process a slow, steady breakfast far more gently than a sharp spike of salt and sugar together. Habit number 4. Pain relief on a dry, empty stomach. This next one caught even some of my own colleagues off guard the first time we discussed it, because it involves a medicine most people consider completely harmless. Over-the-counter pain relievers like ibuprofen and naproxen, taken most mornings for stiff joints, arthritis, or a nagging backache, often before any food or water. Here's the biological detail that makes this so significant. Your kidneys keep a small emergency crew on call, chemicals called prostaglandins, whose job is to widen the blood vessels feeding your kidneys whenever perfusion drops, say, during mild morning dehydration. Think of prostaglandins as an on-call fire crew for your kidneys. The moment pressure drops, they rush in and hold the vessel open so blood keeps flowing. NSAIDs work by blocking the exact enzyme that crew depends on. Take one on an already dehydrated stomach, and you've essentially pulled the fire crew off duty at the precise moment they were about to be needed. The vessel feeding your kidney can constrict sharply, and your filtration rate can drop fast. I want to tell you about a patient I'll call Gerald, 68, a retired mechanic who'd been managing knee arthritis with 400 milligrams of ibuprofen most mornings, taken with nothing but a cup of black coffee, for years. One morning he felt unusually drained, his ankles looked slightly puffy, and when his doctor ran blood work, his creatinine, a marker of kidney function, had spiked sharply. He spent 2 days being monitored while his kidneys recovered after stopping the NSAID and rehydrating under medical supervision. His function came back, largely, but his doctor was blunt with him. That pattern, repeated for years, had almost certainly been quietly wearing down his kidneys long before that one alarming morning. Ask yourself honestly, do you reach for a pain reliever most mornings out of habit? And do you usually take it before you've had any water at all? I need to be very clear here. I am not telling you to stop a medication your doctor prescribed, and you should never adjust or discontinue anything on your own. What I am telling you is this: hydrate before you take a NSAID, take it with food, and have a specific conversation with your doctor or pharmacist about whether a kidney gentler alternative or a different timing makes sense for your situation. If you or someone you love reaches for a pain reliever most mornings, type checked in the comments once you've actually gone and read the label today. It takes 30 seconds and it's worth doing. Habit number 3, the pressure spike nobody's watching. Your blood pressure is supposed to rise a little after you wake up. That's completely normal. It's your nervous system switching your body from rest mode into go mode. But in people whose blood pressure isn't well controlled, that normal morning rise can turn into something far sharper, a genuine spike rather than a gentle climb, and most people have absolutely no idea it's happening because nobody checks their blood pressure at 6:45 in the morning. They check it at a doctor's office at 2 in the afternoon, which tells you almost nothing about what happened hours earlier. Imagine plugging an old lamp into wiring that hasn't been updated in decades. Instead of a smooth, gentle flow of electricity, the whole system dumps a jolt through the line the instant you flip the switch. That's close to what happens inside stiffened, aging blood vessels during a sharp morning blood pressure surge. The pressure doesn't ease in, it slams in, directly against the walls of your kidney's smallest, most delicate capillaries. A study published in the journal Hypertension Research followed patients who already had both high blood pressure and chronic kidney disease for a median of 30 months. Using detailed statistical modeling, researchers found that an exaggerated morning blood pressure surge more than doubled the risk of kidney disease progression, independent of other factors, with a hazard ratio of 2:35. Ask yourself this: do you actually know what your blood pressure looks like within the first hour of waking? Not at the pharmacy kiosk at noon, right after you get up. The solution here is refreshingly simple and inexpensive. A home blood pressure cuff costs very little, and checking your numbers within that first hour on a few separate mornings gives you and your doctor real information instead of a guess. I want to be explicit about something important. Never change the dose or timing of a blood pressure medication on your own based on anything in this video. This is information to bring to your physician, not an instruction to act on alone. Habit number 2. Waking up already behind. By the time your alarm goes off, you've already gone 6 to 8 hours without a single sip of water, losing fluid the entire time through breathing and through your skin. Most people wake up in a mild fluid deficit before they've even opened their eyes. Here's where aging makes this worse. The part of your brain responsible for making you feel thirsty becomes noticeably less sensitive over time, which means older adults often don't feel thirsty until they're already meaningfully dehydrated. On top of that, aging kidneys lose some of their ability to concentrate urine efficiently, so you continue losing fluid even while running low. It's a genuinely blunted early warning system. Think of your kidneys like a water treatment plant that depends on steady water pressure to filter properly. Show up to work that plant with the reservoir already half empty, and it has to strain to process the same volume with a fraction of the supply behind it. That strain shows up as reduced blood flow through the kidney. Research shows that a healthy young adult's kidneys typically receive somewhere around 1,000 to 1,100 milliliters of blood flow per minute. By the time most people reach 65, that number often drops closer to 550 milliliters per minute, largely due to increased resistance in those vessels. Layer a morning fluid deficit on top of an already narrowed system, and the strain compounds. Research estimates that somewhere between 17 and 28% of older adults living independently in this country are dealing with chronic, low-level dehydration without realizing it. I want to tell you about a patient I'll call Margaret, 71, a retired teacher who came to me describing months of morning grogginess she chalked up to simply getting older. Her blood work over the previous year showed creatinine creeping upward, slowly, quietly. When we walked through her actual morning routine, it turned out she genuinely didn't drink anything until mid-morning coffee, purely out of habit. Because she never felt thirsty enough to think about it. We made one change: water first thing, before anything else. Within a couple of months, her energy had noticeably improved, and her follow-up labs had stabilized. The fix: 300 to 500 milliliters of plain water, roughly 1 to 2 glasses, before your feet even finish waking up, before coffee, before breakfast, before anything else touches your lips. And now, habit number 1. The coffee ritual nobody questions. I told you this one would surprise you, and I meant it, for a huge number of people watching this video right now. Coffee is the very first thing that goes into your body each day, before water, before food. Sometimes 2 cups deep before you've eaten a single bite. It feels harmless. It's a ritual, a comfort, the thing that makes a morning feel like a morning. And I want to be honest with you up front. I am not telling you to give up coffee. What I'm about to explain is not about the coffee itself. It's entirely about the order you're drinking it in. Here's what's actually happening inside your body. In the first 30 to 45 minutes after you wake up, your cortisol level, your main stress and alertness hormone, naturally surges by 50 to 100% above its overnight baseline. This is completely normal. It's your body's built-in alarm clock, and part of its job is to mobilize energy by nudging your liver to release stored sugar into your bloodstream, priming you for the day ahead. Caffeine, taken on a completely empty stomach, pours gasoline on that fire before you've had a chance to eat anything that would buffer it. It blocks a molecule in your brain and body called adenosine, and that blockade triggers an additional wave of stress hormones on top of the one your body was already producing naturally, pushing your liver to release even more stored glucose into your blood. Here's the detail that changes everything about how we should think about this. At the very same moment your liver is dumping extra sugar into your bloodstream, caffeine is also blocking the very same adenosine receptors on your muscle and fat tissue that your body relies on to pull sugar back out of your blood and put it to use. Think of your blood sugar system like a water balloon filling from a tap. Food gives it a slow, controlled fill. Coffee on an empty stomach does 2 things to that balloon at the exact same time. It cracks the tap open early, and it jams the drain your muscles would normally use to let sugar back out. This isn't theoretical. Researchers at the Center for Nutrition, Exercise and Metabolism at the University of Bath ran a randomized trial, published in the British Journal of Nutrition, where participants drank a strong black coffee 30 minutes before a standard breakfast drink. Their blood sugar response afterward was roughly 50% higher than when they drank the identical breakfast without any coffee beforehand. What made this finding particularly striking was that a full night of genuinely poor sleep, on its own, did not meaningfully change their morning blood sugar response. It was specifically the pre-breakfast coffee that did. So why does this circle back to your kidneys? Every time your blood sugar spikes sharply, the delicate filtering cells lining your kidneys' smallest blood vessels are directly exposed to that elevated glucose. Under that stress, those cells release tiny signaling packets that carry a substance called TGF-beta, which damages neighboring cells whose entire job is acting as a gatekeeper, keeping protein locked safely inside your bloodstream. Repeat that exposure morning after morning, year after year, and the filtering membrane itself gradually thickens and scars, a process that directly narrows your kidney's long-term filtering capacity. I want to tell you about a patient I'll call Susan, 64, a retired accountant, who had started every single morning with 2 cups of black coffee, nothing else, for more than 20 years, at her annual physical this year. Her fasting glucose came back solidly in the pre-diabetic range, despite an otherwise genuinely healthy diet. When we talked through her mornings, the pattern was obvious. We didn't take away her coffee. We simply moved it. Eat something first, protein and fiber, then have the coffee 30 to 60 minutes later. At her 3-month follow-up, her glucose numbers had measurably improved. Same coffee, same amount, different order. Ask yourself honestly, is coffee genuinely the first thing that enters your body most mornings? Do you typically go 30 minutes or more before eating anything at all? If you're one of the millions of people who has genuinely never eaten a single bite before your first cup of coffee, type guilty in the comments. You are in extremely good company, and unlike most of what we've covered today, this is a 5-minute fix, not a lifestyle overhaul. Before we move into the action plan, I want to pause on something important. Most of what we've discussed today involves habits that strain kidney function gradually, quietly, over years. But there are signs that go beyond gradual and deserve a conversation with your doctor promptly, not a wait-and-see approach. Please reach out to your physician soon if you notice foamy or bubbly urine that doesn't resolve, new or worsening swelling in your ankles, feet, hands, or around your eyes, a noticeable drop in how often you're urinating, or urine that's turned unusually dark, persistent fatigue paired with nausea, a poor appetite, or an unusual metallic taste in your mouth, blood pressure readings that consistently sit at or above whatever threshold your own doctor has identified as concerning for you, especially in the morning, or muscle cramping, confusion, or an irregular heartbeat, all of which can point to an electrolyte imbalance tied to kidney strain. These signs deserve real medical attention, not a home remedy or a wait-and-see week. And I want to say this plainly, because it matters. Nothing in this video is telling you to stop, start, or adjust any prescribed medication, especially a blood pressure medication or a pain reliever your doctor has specifically prescribed, without their direct guidance. Everything here is educational, meant to inform the conversation you have with your physician, not to replace it. Here's exactly what I want you to do with everything we've covered. Tonight, place a filled glass or water bottle somewhere you'll see it before you see your coffee maker, on the nightstand or right next to the coffee machine itself. If you take a morning pain reliever out of habit, set it beside that glass as a visual cue to drink first, and lay out tomorrow's breakfast ingredients tonight: eggs, oats, berries, so the lower sodium, lower sugar option is simply the easiest one to reach for. Tomorrow morning, drink 300 to 500 milliliters of water, roughly 1 to 2 glasses, before anything else touches your lips, including coffee. Move your body for 10 to 15 minutes before you sit down for the day. A short walk, some gentle stretching, even just puttering around the kitchen, and eat something with protein and fiber before your first cup of coffee, saving the coffee itself for 30 to 60 minutes later. This week, if it's been more than a year, ask your doctor for a simple blood test that includes creatinine and EGFR, the 2 numbers that show how efficiently your kidneys are actually filtering. Pick up an inexpensive home blood pressure cuff and check your numbers within the first hour of waking on 3 separate mornings. Then bring those readings to your next appointment, and spend 5 minutes with your pharmacist reviewing every over-the-counter pain reliever, supplement, and prescription you take regularly, asking specifically whether any of them carry kidney-related considerations, ongoing. Keep coffee in your life. Just let it follow breakfast instead of leading it. Treat the first hour after waking as a small protected window, hydrate, move a little, Eat something balanced before the day's obligations take over, and revisit this list every few months, because habits have a way of quietly creeping back in, the same slow way they built up in the first place. Let's bring this together. We covered 7 ordinary morning habits: sitting still for that first hour, an early cigarette before any food, a sodium and sugar-loaded breakfast plate, a pain reliever taken on a dry, dehydrated stomach, a blood pressure surge nobody's actually watching, waking up already running a fluid deficit, and the coffee ritual almost none of us have ever thought to question. I want you to hear this clearly. None of these 7 habits require a prescription to fix. Every single one of them is already inside your control, usually with nothing more than 5 or 10 extra minutes and a slightly different order to your morning. You're not being asked to overhaul your life. You're being asked to hydrate a little sooner, move a little earlier, and let your coffee follow your breakfast instead of leading it. If this video opened your eyes to something you genuinely never considered, share it with someone you care about, a parent, a spouse, a friend who reaches for coffee before anything else every single morning, the same way so many of us do. This kind of information is worth passing along. If you're not subscribed yet, this is your invitation. I publish new, research-backed videos every single week, built specifically for adults who want to understand what's actually happening inside their bodies, in plain language, without the fear-mongering. And before you go, tell me in the comments, which of these 7 habits is your habit? The one you're going to work on changing first? I read every single response, and I promise you, it genuinely shapes what I cover next. Your kidneys filter something close to 50 gallons of blood every single day, quietly, without a single complaint, for your entire life. Give them 5 honest minutes each morning, and they'll keep doing that job for decades to come. I'm Dr. Richard James. Take care of your kidneys. Take care of your life. I'll see you in the next one.